Strategic partnerships. What are we looking for here at Lad Dental Group? So find a couple of our videos and I'll put them in the comments section comparing a financial partner to a strategic partner. But here at Lad Dental Group, our DSO, we are a strategic partner. So we have most of our dental infrastructure laid. We have our vertical integrations in place. We have our specialists. So really for us, we are looking to grow out our operational density and to continue to synergize the HR functions we have in place, our insurance departments that we have in place. That's really where we get to see our multiple expansion, is through those synergies. So here at Lad Dental Group, the number one thing that we're looking for is for good dentists and for good office cultures. As we've said in numerous videos, really your business is only as good as your people are. So that is first and foremost, and that is the number one thing that we're looking for when we're going around and doing due diligence on practices. For us, for those of you guys that are familiar, our 9 locations are all in North Central Indiana. We really want to continue to grow out our operational density and serve rural communities, because that's where we think the profession, again, us as dentists, we pride ourselves on serving the underserved communities. And we also think that there's a lot of value and opportunity in the rural communities. So that is primarily where we are looking. That's our intention of growth. And as we go around and look to different offices, again, there's a couple different stages of careers that we can look for. I think the demographic that's going to get have the most increase in these next 5 to 10 years is the dentist, probably 40 to 55, who's performing well, but just is really kind of tired of the back end management and the hiring and the HR function and the payroll and all of those things that just, again, require constant effort and energy and oversight. I just think that there's a bandwidth issue happening here, and I don't foresee things getting less complex. I see them getting more. So as those complexities just increase, I do think the 45 to 55 the 40 to 55 demographic is going to continue to look for extra back-end help, and I think the DSO fits that void well. Another opportunity that we're very interested in is dentists that are looking to retire in practice. So say they're more 55 to even at 65 and they want to spend the next 5 to 10 years retiring in practice. We would love that. That is another opportunity that we are very interested in, and it's the model that we're doing with Dr. Todd Dill and his awesome Logansport practices. He really wants to retire in practice. Well, we found a wonderful dentist in Dr. Kelsey McCoy, who actually grew up as a patient at Lad Dental Group. And more content to come on that, because that's just such a cool, fascinating story. But really, what we were able to provide Dr. Dill is he still loves dentistry. He loves his patients. He's just right now, he's at the point where 3.5 days a week is too much dentistry. So he wants to start to kind of retire in practice. So he's going to mentor and really guide Dr. McCoy these first couple years. And as she continues to build her skill set, he's gonna start to take some, kind of just phase out and phase down in that practice. So going from 3.5 to 3 to 2, ultimately to 1, and then we'll go into retirement. But it's a really nice way to retire in practice. One of the things that we've seen on the other side of the aisle is there's a lot of dentists that get to that 60, 65, and almost 70 years old of not knowing what to do with their practice. So they're kind of retiring in practice, but the problem is when that starts happening is your patient base really starts to diminish. And then when you go to find value of your practice, if you've been retiring in practice for the last 5 years and haven't done a bunch of infrastructure with either IT or dental equipment or new patient growth, there's really not a lot there to provide value to who your partner could be. So that's something really to think in mind. If retiring in practice is something that is attractive to you, please reach out to us, as that is an opportunity that we're very interested in. We love the mentorship and guidance. And again, going back to the beginning of this video, why it's first and foremost most important to be good people is that's what we're really investing in. We're investing in that doctor to provide the mentorship and guidance to that associate that we're going to put in practice, and also to the office culture that they have have already built. So again, first and foremost, it has to be people first. Obviously numbers matter, but please comment down below if you're in either of those two segments of again, kind of 40 to maybe 55 in loving dentistry, but a little bit burnt out on the back end management, or if you're retiring in practice. Both of those opportunities we're very, very interested in. And the third and final would be putting an associate into a practice, which we've done before as well. It's just normally the two most successful models that we've seen are the models that I just mentioned. Again, the 40 to 55, or the retiring in practice. So again, please comment down below. We'd love to have more and more conversations, and we'd love to continue to build out our operational density, because I think it really allows us to provide the gold standard of group dentistry because of our economies of scale and our economies of labor and our economies of supplies. The operational density, I think, is a real unique value prop to us, and it's something that really aids and benefits our providers as well. So stay tuned for more. Thanks as always.